Okay, now let's think of another disease state that can cause increased hydrostatic pressures. And one of them is actually cirrhosis, okay? Liver cirrhosis. Okay, what's happening in liver cirrhosis? Well, if we have a liver here, right? Um, Chronic damage to basically the hepatocytes that are all here, right? Filled with hepatocytes, chronic damage to these hepatocytes. What happens when a cell gets damaged? It tries repairing itself, right? And once it tries repairing itself, what does it use to repair itself? Collagen, fibrin, etc., all these different materials to repair it. Well, if you keep damaging something and repairing it, it's basically just adding it's basically causing fibrosis, right? Adding all of these little things to it, and it's causing fibrosis. Well, let's look at now what drains into the liver. The portal vein, right? Okay. The blood from the portal vein drains into the liver. All these hepatocytes are supposed to take that blood, process it, remove all the toxins, do what it has to do, right? Now, what makes up the portal vein? Well, you have your superior mesenteric vein, right? And this joins with the splenic vein, right? And we have another vein here, the inferior mesenteric vein, which joins it, right? Joins the splenic vein, and both these join up to make the portal vein. Well, let's go back now. Take a patient, 45-year-old male, with a chronic history of alcohol abuse. We can assume that he probably has a good amount of liver cirrhosis, fibrosis damage here, right? So what's happening here? If his liver is cirrhotic and fibrosed, can the blood from the portal vein easily go into the liver? No, it can't because all this is damaged, right? It can't easily go. So what happens? A backup. The same thing like we talked about in CHF, we have a backup here. If we have a backup of blood all over here, what's happening to my hydrostatic pressure in these veins here? It's increasing. And remember what we said, when we have increased hydrostatic pressure in veins, what happens? Leakage of plasma, right? We have leakage everywhere. This is why, when you think about all the veins that are connected to the SMV, the splenic vein, inferior mesenteric vein, we get esophageal varices. What are esophageal varices? These are the small veins in the esophagus that are distended and cause leakage, right? And these are the veins that become so distended that they tend to bleed and hemorrhage, right? They tend to bleed a lot because of the increased hydrostatic pressure. What else have you noticed? Caput medusae, right? I'm not sure if I'm spelling that right, but it's on the belly, right? All the umbilical veins are distended. Why? Same thing, increased hydrostatic pressure. Okay, so when you see all the distended veins everywhere, that's why, because of increased hydrostatic pressure due to the fibrosis, right? Now, cirrhotic patients get edema. Now, we talked about hydrostatic pressure, but that's not the only reason why. Remember, what's the protein that's produced in the liver? Albumin, right? We talked about this. This is where you connect these concepts. You have to connect all the information here. So, cirrhotic patients get edema for two reasons. Because they have low albumin, and when you have low albumin, you have low oncotic pressure. Remember that? And you have edema because of high hydrostatic pressures. Okay? So it's a combination of the two: low albumin, low oncotic pressure, and increased hydrostatic pressure from here, okay? Because their liver can't produce albumin anymore. Make sense? Okay.